This video will show you the times when not to take Lexapro. Coming up! This channel is about tips and advice to promote your health and to keep you young and healthy. Therefore, think your health and hit the subscribe button. This video is part 2 of a video series looking at Lexapro. Click in the description below for part 1. What is Lexapro? Lexapro belongs to a class of drugs known as serotonin reuptake inhibitors, SSRIs for short. The generic term is escitalopram. Warning about Lexapro. When you're taking Lexapro, you should be aware that some short-term studies showed that there was an increased risk of suicide and suicidal thoughts, especially in children, adolescents, and younger adults. When should you not take Lexapro? You should not take Lexapro at the same time with a group of drugs called monoamino oxidase inhibitors, MAO inhibitors for short. Do not start taking Lexapro during the 2 weeks after you stop a MAOA inhibitor and wait 2 weeks after stopping Lexapro before you start taking a MAO inhibitor. This is because it can cause a condition called serotonin syndrome. Serotonin syndrome occurs when you take medications that cause high levels of the chemical serotonin to accumulate in your body. Because the levels of serotonin are high, it can lead to extreme nerve activity. This results in dangerous symptoms such as heart racing, seizures, high fever, and even passing out. You're asking yourself, what are examples of monoamino oxidase inhibitors? Well, I'm going to show you a list. Linezolid, an antibiotic used to treat certain bacterial infections. Methylene blue, a potent MAO inhibitor that is used to treat a hematological condition called methemoglobinemia. Procarbazine, used in addition with other medications to treat Hodgkin's disease. Rasalagilene, used to treat symptoms of Parkinson's disease, and salicyline. This can be used with other medications to treat Parkinson's disease as well. What other drugs should you be aware of and not take if you are on Lexapro? These drugs and supplements that you will hear of can cause an increased level of serotonin. And some of these drugs include migraine drugs called triptans, or other antidepressants or SSRI drugs like fluoxetine or paroxetine, SNRI drugs such as duloxetine or venlafaxine, an herbal remedy used for depression called St. John's wort, pain drugs such as fentanyl or tramadol, and street drugs such as MDMA, also referred to as ecstasy. The symptoms you should watch out for in serotonin syndrome are GI symptoms such as nausea, vomiting, and diarrhea, confusion and agitation, changes in blood pressure, changes in temperature, headache, dilated pupils, muscle twitching or loss of muscle control, tremors, heavy sweating, shivering, and rapid heart rate. So what should your doctor do? After your doctor stops the drug, he or she will start symptomatic or supportive treatment, which is usually done in the hospital setting, and your doctor might choose to start you on intravenous fluids. You should start feeling better within a couple of days once the drugs are out of your system. And here are other reasons you might need to avoid Lexapro. 1. If you take Lexapro with drugs belonging to a family of drugs called non-steroidal anti-inflammatory drugs, or NSAIDs for short, you may bruise yourself or bleed easily. Examples of NSAIDs are aspirin, ibuprofen such as Motrin or Advil, naproxen such as Aleve or diclofenac. Drinking alcohol and Lexapro together is not a good thing. There can be an interaction with a blood thinner called warfarin, which can lead to bleeding. Should not really mix it with stimulants such as Ritalin, as this can cause increased levels of Lexapro and therefore serotonin. And if you're having side effects caused by Lexapro, reach out to your doctor so your doctor, he or she, can reduce the dose, change the dose, or put you on another class of an antidepressant or another SSRI. And if you click on the link above, this link examines the side effects caused by Lexapro, which is part 1 of this video series. And if you're interested in other videos, click right here or click right here and subscribe. Have a good day. Think your health. Coming up. This is crazy. Why are there so many tongue twisters? Hemoglobin. Why can't I say it? Done.